Okay, we are moving on to Chapter 7, which is the axial part of the skeleton. So we're talking about, think about the axis. So we're going to be talking about the skull, the vertebral column. So think about an axis of something as kind of the middle point, like maybe the axis of the planet is what everything else revolves around kind of thing. So our axial skeleton. So the skeleton itself consists of 206 bones, two divisions, the axial skeleton and the appendicular. As you can see on the side picture, the axial skeleton is in blue. The rest is the appendicular skeleton. So the axial skeleton, again, the skull, the vertebral column, the rib cage. Appendicular skeleton are your appendages, your limbs, and their girdles that hold them in place. So this is pretty much what I just said, but the axial skeleton is 80 bones. They lay around the longitudinal axis of the body. So your skull bones, your auditory ossicles, which are your ear bones, your hyoid bone, which is right in your neck, your ribs, your sternum, which is your breastbone, and then the vertebral column. Appendicular, 126 bones, the upper and lower limbs, and the bones that form their girdles and connect the limbs to the axial skeleton. So axial skeleton we're covering in this chapter. Appendicular skeleton we will cover in the next chapter. Out of the ossicles in your ears, your auditory ossicles, we will touch base on those, but those are actually covered in more detail in chapter 17, which is the special senses, and you have that in A&P 2. So each bone, again, is named according to the classification. We went over this in chapter 6, but just to recap, long bones are longer than they are wide. Short bones are short and fat, kind of cube-shaped. Flat bones are flat. Irregular bones are shaped irregularly, and sesamoid bones like the patella. So again, this is just a recap, talking about long bones versus short bones versus flat bones. So we covered this in chapter 6, but again, as always, if you have questions, send me a message. Irregular and sesamoid bones, again, sesamoid bones vary in number, but their main point is to protect the tendons from excessive wear. So the patella, of course, is the best example. They themselves can develop fractures, however, because they're under a lot of stress and tension. Sutural bones are also known as Wormian bones. They're basically extra bone plates located within the sutures of the cranial bones. So as you can see in the picture there, a couple of sutural bones between the parietal and occipital bones. These are isolated examples. They're unusual, but they're not rare. Bones also have characteristic markings on their surfaces that are adaptations, basically. We have two major types of surface markings, depressions and openings, and then processes. As the name implies, depressions and openings, depressions kind of go down and openings are open, but they allow for the passage of blood vessels and nerves and also help form joints. Processes stick out, so projections or outgrowths that form joints and also serve as attachment points for ligaments and tendons. So a process is basically any projection of a bone, whether it's large or small. A spinous process is a slender projection from a vertebrae, and then a foramen is an opening in the bone through the blood vessels and nerves can pass. So you can see the vertebral foramen on that vertebrae, the big opening, which is where the spinal cord passes through. And then on the side there, the intervertebral foramen, which is where your nerves kind of come out from the spinal cord. If a bony process is large, round, and articular, it might be called a condyle. The condyles of the humerus, for example, are the trochlea and the capitulum. An epicondyle is a bony protuberance above a condyle. So epi is above, epicondyle above a condyle. So you have the lateral and medial epicondyles on the humerus there. And then a fossa is a shallow bone or shallow depression in a bone. So you have the coronoid fossa, the olecranon fossa. So those are the projections that part of another bone will kind of rest inside. A tubercle is a small rounded projection, like the pubic tubercle there on the pubis. And a tuberosity is a large bony prominence that is not articular, so it doesn't articulate with any bones. The tibial tuberosity is right in front. It's basically right below your kneecap on your shin, in a nutshell. A meatus is a tube-like canal, so the external auditory meatus is a good example. You can see that in the skull and the temporal bone. Trochanters are two very large bony projections on the femur. So you have the greater trochanter and the lesser trochanter, and you can see on the picture the femur over there. The greater, of course, is the bigger one. And here's a chart with all of these examples and descriptions and the official name of the marking, and then gives you some examples to look at. Make sure you look at those pictures in your book, because on your lab practical, you're going to have to name some bones, you're going to have to name some markings, and you're going to have to tell me if it's a right or a left in some cases. So there's a lab practical study guide posted under lab material. Make sure you print that out and study it. There are little spaces in front of each marking or bone, so you can kind of check them off as you feel comfortable that you know them and can identify them. So here's some more markings. Okay, so the axial skeleton is your central axis, so the skull, vertebral column, ribs, and sternum. The skull protects and supports the brain and special sense organs, so it's very important. Besides forming that large cranial cavity, it also forms several smaller cavities. So you have the nasal cavity in your nose, the orbits, which are your eye sockets, the paranasal sinuses, which are kind of up here. And they're small cavities that house organs involving hearing and equilibrium as well. So you have sinuses within your skull, and part of what sinuses do is actually lighten your skull. So that's very helpful because we carry our skull up all day long pretty much. So the bones of the skull are grouped into two major categories, cranial bones and facial bones. Facial, of course, on your face, cranial, your brain mainly. So we have 8 cranial bones. There's a frontal bone, 2 parietal bones, 2 temporal bones, the occipital bone at the back, and then the sphenoid and the ethmoid bone, which you can't see on me because they're inside. 14 facial bones, so you have the mandible, the maxilla, the zygomatic bones are your cheekbones, the nasal bones, the lacrimal bones are up in here, the palatine bones are all the way in the back, the inferior nasal conchae and the vomer bones you really can't see very well, but the vomer bone is kind of up inside the nose. So the single frontal and occipital, yeah, you can see the frontal, the occipital's in the back, parietal on the top sides, temporal right above your ears, and then as you can see here, the sphenoid bone is the green bone, and it kind of goes all the way across your skull from one end to your other. And then the ethmoid bone is kind of in front of that. So here it just gives you another view of those bones, and you can see the ethmoid bone inside there. A suture is basically an immovable joint between the bones of the skull, so it's a seam. We have 4 main ones, the lambdoidal suture, which is in the back by the occipital bone, the squamous suture, which is the side, the parietal and the temporal bones joined together, the coronal suture, which goes across the top, which is your frontal bone and your parietal bones, and then we have the sagittal suture, which goes down the middle, which you cannot see in this picture. Fontanelles are little spaces between the cranial bones in babies. We talked about these in Chapter 6, but they're the soft spots, mainly the one on the top of the head, the anterior, and one on the back of the head, the posterior. But those fontanelles will become sutures in adults. The paranasal sinuses, frontal bone, the ethmoid bone, the sphenoid bone, and maxillary bones are here. And again, sinuses kind of lighten the load, so to speak. They're pockets, but the problem with these pockets are that they can get filled up with bacteria sometimes, and then you get what's called a sinus headache. pressure from all of the bacteria can cause massive pain. So while they do serve purposes, there's kind of a negative too. So with the exception of the ethmoid sinuses, the other are paired. They're lined with mucous membranes, and they humidify and warm the air as it comes in through the nose. As I said, they reduce the weight of the skull and help resonate the sound of your voice. So you can see the frontal sinus, the ethmoidal cells of the ethmoidal sinus there, the sphenoidal sinus, the maxillary sinus. So all kind of in the front of our skull here. So anytime you have a sinus headache, that's often where you have the pain and pressure. Of the 8 cranial bones that fit together, the sphenoid is called the keystone bone. Keystone bone, because it's like an arch. If you take the sphenoid bone out, the rest of the bones will kind of all crumble. So that sphenoid bone that comes across from one side to another kind of holds everything in place. And there's a picture of it. It looks like a bat. Okay, the facial bones. You have a mandible, 2 maxilla, the vomer bone, the nasal bones, 2 zygomatic bones, lacrimal bones, palatine bones, and the inferior nasal conchae. So the nasal bones are underneath this cartilage. The zygomatic bones are your cheekbones. The maxilla are these, and they're fused together. Mandible is your jawbone. The vomer, inside your nose there. What did I miss? Lacrimal are up in here. Palatine and inferior nasal conchae are on the inside. So the ethmoid bone does have a very important area called the perpendicular plate. And then you can see the middle and inferior nasal conchae as well. You can see the vomer bone. Like I said, it's down in the nose. The fused maxilla, the mandible, your zygomatic bones, lacrimal bones, and nasal bones. Here's another view showing you all of those bones. So as you can see, the vomer bone is actually a pretty big bone. And there, that tiny blue spot behind the maxilla is the palatine bone. So besides protecting the brain, the skull provides a framework for muscle attachment. And so we can move our head and we can produce facial expressions. The facial bones form the framework of the face and provide entrances, of course, for the digestive and respiratory systems. The hyoid bone is the only bone in the body that does not articulate with another bone. It's kind of suspended between the mandible and your larynx, which is your voice box. It is an attachment site for tongue muscles and neck muscles. And very importantly, if somebody is manually strangled, oftentimes they can tell because their hyoid bone is cracked and broken. Issues with development that can happen, the cleft palate is a big one. If the hard palate does not fuse all the way during development, then you have that opening. But there's surgery for that now. Spina bifida occurs if the vertebral arch does not fully close around the spinal cord. So what happens is this material from the spinal cord can get through and leak through the opening. This used to be a horrible thing for babies, but now we can actually perform surgery on these individuals and kind of minimize the damage. This is also going to be discussed more in chapters 12 and 13, so later on in the semester, because a lot of times it happens from an incomplete fusion of the neural tube, which is during embryonic development of the nervous system. So that's why we kind of talk about it at that point as well. This is just a picture showing you intrauterine surgery on a spina bifida baby. And again, this can help minimize the damage of the exposed neural tissue so that the baby can kind of proceed to live a normal life. The spine is composed of the vertebrae. So a vertebrae has a body, which is that main portion, a pedicle and a lamina, which form the vertebral arch and surround the spinal cord, and then several processes, which act as points of attachment for muscles. We have 7 cervical, 12 thoracic, 5 lumbar. So if you remember, you eat breakfast at 7, lunch at noon, dinner at 5. You got 7, 12, 5. And then the sacrum and the coccyx are single bones that are fused from several vertebrae. Can be anywhere from 3 to 5, depending on the individual. So from the cervical region to the sacrum, each vertebrae has that large central hole, which is called the vertebral foramen. And as I said earlier, that's where the spinal cord travels through. At each level on both the right and left sides, you have the intervertebral foramen, which, as I said earlier, the spinal nerves can come out. And then between the vertebrae, we have fibrocartilage intervertebral discs. Now, fibrocartilage, remember, is the strongest type of cartilage that we have. However, it can get hurt. It functions to absorb shock and form joints. So it's strong, but it still permits movement of the spine. And over the daily period of events, it actually becomes compressed a little bit. And then as you sleep and take the load off, it regains its thickness and hydration and moisture, and everything goes back to normal. So if you measure yourself in the morning and then measure yourself right before you go to bed, you'll actually be a little bit shorter. Over time, we're going to talk about these discs. They have a tendency to lose their hydration and thin out. So elderly individuals actually are shorter than they were as an adult. But the intervertebral disc is surrounded by what's called an annulus fibrosus. And that annulus fibrosus is very strong. However, it can tear. And if it does tear, the center gel-filled nucleus pulposus starts to leak out. When that starts to leak out, it can pinch nerves and be very painful. So the nucleus pulposus is that inner gelatinous material. That's what gives it its elasticity and compressibility. The annulus fibrosus surrounds that, and that's composed of collagen and fibrocartilage, so that's where the strength comes from. Again, they act as shock absorbers during all activities, and they allow the spine to flex and extend. So they flatten during the day, so by the night you're actually a few centimeters shorter than you were when you woke up. But again, they rebound, they're elastic, and they go back to normal, so you'll be your normal height in the morning. A herniated disc is also called a ruptured disc or a slip disc. It's basically a severe physical trauma to the spine. Usually what happens is an annulus fibrosus ruptures, and then the nucleus pulposus protrudes through the tear. It presses on the spinal cord, the spinal nerves, and the pain can actually be excruciating. I actually have 7 herniated discs. I have 4 in my thoracic area from T3 to T7. And then I have 3 in my lumbar area from L3 to S1. So that is part of the reason why I have pain on a regular basis. But I also have what's called a morphine pump in my stomach. And what it does is it pumps morphine to those nerves so that the nerves are kind of dead and cut off so that I don't feel the pain. The pain is still there, but I just don't feel it. And no, I'm not high or anything. It goes straight to that intervertebral disc, those nerves right there. So it goes straight into that intrathecal space. So I don't feel it whatsoever. Just so you know. So this is showing you an intervertebral disc. You can see the annulus fibrosus there is torn, and the nucleus pulposus is protruding out onto the spinal cord and nerves. Here's showing you a different view. Some more disc problems. Up top you have your normal disc. Then you have a degenerated disc, which is basically your disc starts to degenerate over time. It can happen when you're young. It doesn't matter. It can be like wear and tear kind of thing. Then you have a bulging disc before the annulus pulposus the annulus fibrosus tears. You have a herniated disc once the annulus fibrosus ruptures and the nucleus pulposus protrudes all the way through. You have a thinning disc, which it just thins out over time, especially as you get older. And then you have disc degeneration with osteophyte formation. What's going to be happening there is the disc is actually being replaced with bone. So that's going to be very painful eventually because you're going to lose all of your flexibility and you're basically going to have bone on bone. So relative to the front of the body, we have the cervical and lumbar curves that are convex, and we have thoracic and sacral curves that are concave. So that's the natural curvature of our spine there. Issues, we could have scoliosis, which is a lateral miscurvature, kyphosis, which is also called humpback, where you have an abnormal thoracic curvature, or lordosis, which is also called swayback, where you have an abnormal lumbar curvature. This is just showing you the different types of vertebrae, so you can see cervical versus thoracic versus lumbar. Lumbar have the biggest bodies, and it makes sense because they are the largest. They need the most support because they're the lowest down on the body, so they take the brunt of everything. Cervical have the smallest bodies, and C1 and C2 are actually the axis and the atlas, so those are special vertebrae that allow us to be able to move our head like we can. And then thoracic vertebrae in the middle, it just reminds me, their body reminds me of like an alien being like, ah, kind of thing. So make sure you can tell the difference between the three different types. As I said, the atlas and the axis are the first two, C1 and C2. The atlas is named so because it holds up the head, like the Titan of Greek mythology supported the world. C2 is called the axis because that's the pivot point, so that's why we can turn our head. Without these first two, the head on neck range of motion will be very limited. So you can see the dens of the axis sticks up, and that's kind of what our head pivots on. Then you have the 12 pairs of thoracic. The 5 lumbar, again, they're a lot thicker because they bear more weight. The sacrum formed from the fusion of 5 different vertebrae during fetal development, so usually S1 to S5. And then the coccyx is that tailbone, and that can be anywhere from 3 to 5 fused vertebrae, as I just said. The thoracic cage is the final part. So you have the sternum, the ribs, and the costal cartilage, and then, of course, the vertebrae in the back. Very important functions to enclose and protect the organs and thoracic and abdominal cavities. So we have our heart, we have our lungs, so they're protected by the thoracic cage. Also, our kidneys, to an extent, slightly protected in the back. They also provide support for the upper limbs and play a role in breathing, which you will learn about next semester when you cover respiratory. The sternum, or the breastbone, is anteriorly in the center of the thoracic wall. It consists of 3 parts: the manubrium, the body, and the xiphoid process. The manubrium is at the top, the body is the main portion, and then the xiphoid process is a little kind of triangular piece at the bottom. The 12 pairs of ribs give structural support to the sides of the thoracic cavity, and the costal cartilage are hyaline cartilage that connect the sternum to the ribs. Again, hyaline cartilage, so it's the weakest cartilage, but it's the most abundant in our bodies. That helps the elasticity of the thoracic cage, so part of the reason we can breathe in and out so well. So here you can see in the middle there the sternum, you have the manubrium on top, the body is the big center portion, and then the xiphoid process, the little kind of triangular looking portion at the bottom. They're all fused together. And then the costal cartilages that connect the ribs to the sternum. The upper 7 pairs of ribs are called true ribs because they directly attach to the sternum. The bottom 5 pairs are called false ribs because they attach to the sternum indirectly. So if you look at the picture, you can kind of see that all of the cartilages come together and then attach to the sternum. And the last 2, the 11th and 12th ribs, are actually called floating ribs because they're not attached at all. So as we age, intervertebral discs become thin, less hydrated, less elastic. your risk of disc herniation goes up a lot. You have a loss of stature by several centimeters. This is very common after the age of 55. Costal cartilages ossify, causing that thorax to become rigid, so you can't breathe like you were able to before. All bones lose mass. You're basically going to be subject to a lot of injuries because of all of this loss, basically. If you fall, it could be detrimental now. You could break a hip or something, whereas before you might not have. It's a lot easier to rupture a disc than it was in younger age. So that is it for Chapter 7. As always, if you have any questions, please just send me a message and ask. Otherwise, I will be recording the next one shortly. Bye.